Hi everyone, I'm Lance Rubin, RN, PMHNPS for student. Today's date is 10/08/2023. This presentation is called Psilocybin, the Psychedelic Mushroom, an Evidence-Based Perspective. And let's dive in. Okay, let's talk about psilocybin, what it is and how it works. It's primarily found in certain fungi and mushrooms. It's a topic of interest for us, not just for its therapeutic potentials, but for its role in substance abuse. As a tryptamine alkaloid, it's known for its potential psychedelic effects. Psilocybin is a prodrug, so when an individual takes psilocybin, it then converts to psilocin and then interacts with our serotonin receptors. This is where the risk factors come into play and where abuse comes into play. It can lead to altered perceptions and cognition changes, everything from mood swings and distortions of time and space perception. The psychedelic experience and abuse. The experiences induced by psilocybin, like auditory, tactile, or visual hallucinations, vary greatly from person to person. But in the context of abuse, these experiences can escalate to dangerous levels. This is heavily influenced by the dose, the user's psychological state, and the user's environment. As PMHNP students, our focus here is to assess the risk associated with psilocybin abuse. This includes exacerbating underlying psychiatric conditions, including intense anxiety or paranoia and leading to disordered thinking. It's also a Schedule 1 substance, reflecting its high potential for abuse. It's a major concern in the field of mental health, particularly considering its widespread use and the potential for harmful effects. We're diving into this to understand the full scope of psilocybin abuse in society and specifically the why, the how, and the impact it has on individuals. Our goal in this presentation is to critically analyze the patterns of its abuse, the potential for harm, and the challenges it presents to mental health professionals. Okay, let's talk about the history of psilocybin's abuse. In the past decade, we've noticed a significant uptick in psilocybin use, especially among young adults. This increase is seen to be driven by this allure that it's a natural or supposedly safer recreational drug, especially when compared to other substances like cocaine, heroin, alcohol, or other synthetic psychedelics like LSD. However, psilocybin use isn't without its dangers. Some users display impaired judgment under its influence, leading to accidents, self-harm, or even endangering others. A particularly sobering incident occurred in Canada involving a 19-year-old pre-med student with no psychiatric history. After ingesting magic mushrooms or psilocybin for the first time, he tragically killed his father and his father's girlfriend. This case illustrates how even first-time use of the drug, even in individuals without a psychiatric history, can lead to severely impaired judgment and catastrophic consequences. We've even got reports of acute psychosis and mental health crisis triggered by psilocybin. This is particularly alarming for those with a history of mental illness or a predisposition to psychotic disorders. In certain cases, such episodes have resulted in dangerous behavior, posing a threat to both the individual and to those around them. Legal and criminal concerns. There have been instances linking psilocybin use to criminal behavior, including acts of violence. It's important to know that these behaviors can have various underlying causes, and it's not always fair to directly attribute them to psilocybin. A major concern is the unregulation or the unregulated status of psilocybin mushrooms. Users often don't know the strength or the purity of what they're taking, which can lead to adverse reactions, potential overdose, and risky behaviors. Challenges in managing its abuse. Taking psilocybin abuse is tricky. Its effects can tackling psilocybin abuse is tricky. Its effects can vary widely from person to person. We're still gathering comprehensive data on its misuse, and the shifting legal societal views on psychedelics add another layer of complexity. Let's dive into the prevalence and epidemiology in the United States of psilocybin. According to the most recent National Survey of Drug Use in Health, psilocybin, as part of the broader category of hallucinogens, is used by a notable but relatively small percentage of U.S. citizens. Its usage is particularly prevalent among young adults aged 18 to 25, and this is a demographic we often see in clinical settings. There has been a gradual increase in the use of hallucinogens over the past decade. This trend is thought to be influenced by changing perceptions of psychedelics and their potential therapeutic benefits. Despite its Schedule 1 classifications, indicating a high potential for abuse and no accepted medical use, the societal attitude towards psilocybin is shifting, particularly due to an emerging set of research on its possible mental health applications. Usage varies by demographics such as age, educational level, and geographic location. Understanding these variations can help us anticipate and address the unique needs of different populations in our practice. We need to be aware of the potential mental health implications of psilocybin use. While some studies suggest therapeutic potentials, there are also risks, especially for individuals with a predisposition to psychosis or other mental health disorders. We should also consider the potential for psilocybin to interact with psychiatric medications and the importance of a thorough substance abuse history in our assessments. Now let's talk about how psilocybin affects those with mental health conditions. If someone has a history of psychosis, schizophrenia, or bipolar disorder, either personally or through their family, using psilocybin can be pretty risky. It can trigger psychotic episodes and manic states and can really destabilize someone's mental health. For adolescents and young adults, their brains are still developing, so this makes them more sensitive to the effects of psychoactive substances. Using it during these formative years could have long-term impacts on their cognitive and emotional growth. Even though psilocybin isn't traditionally addictive, individuals with past or substance abuse history might find themselves using it in a problematic way. There's this pattern of psychological dependency and escapism that can develop, leading to repeated use and its own risks. Here's a gray area. We don't fully understand how psilocybin interacts with various psychiatric meds, so for those already undergoing mental health treatment, this lack of data can mean unexpected complications or reduced effectiveness of their medications. Psilocybin can bring about intense emotional and psychological experiences. For some, this can turn into a quote unquote bad trip, which can be really traumatic, especially if they're not mentally prepared or don't have the right support. The environment where psilocybin is used matters a lot as well. An uncontrolled or unsupportive setting can lead to negative experiences. People in unstable living conditions or without strong support networks are more vulnerable to adverse outcomes. Short-term side effects of psilocybin use. Let's start with bad trips, which are far from rare with psilocybin. They're very unsettling, often filled with terrifying hallucinations and intense anxiety. People might experience panic attacks or overwhelming fears, like the fear of dying and totally losing control. These experiences aren't short-lived either. They can last for anywhere between 3 hours to 8 hours. Altered perception and hallucinations. As far as hallucinations go, they can come in any form, from tactile, auditory, visual, command, etc. Users can lose track of time and space and even experience synesthesia, which is when your senses get all mixed up, like seeing sounds or hearing colors. It can be pretty disorienting. Emotional and mood fluctuations. The emotional roller coaster with psilocybin is something else. It can be like a swing from intense anxiety and paranoia to deep fear. The unpredictability of these emotional responses is part of what makes psilocybin so risky. Cognitive effects. Cognitive functions take a hit as well. Users often find it hard to concentrate, their thought processes get muddled, and confusion is very common. While some might believe they're gaining profound insights, the reality is often more about disturbing and disordered thinking. Physical symptoms. Physically, psilocybin isn't kind to the body either. Nausea, dizziness, and muscle weakness and poor coordination are pretty standard. And users are not surprised by an increased heart rate, higher blood pressure, and body temperature changes. Long-term side effects. Psilocybin can trigger lasting psychotic disorders, notably to those with a psychiatric history or family predisposition. Some users experience persistent changes in vision, such as seeing halos or trailing images. This is known as hallucinogen persisting perception disorder, or HPPD. Long-term use has been linked to ongoing mood changes, including extended periods of anxiety or depression that persists beyond the immediate effects of the drug. There's evidence to suggest that frequent psilocybin use could impair memory and concentration over time. Reports indicate that some users experience enduring shifts in their personality or outlook on life after using psilocybin. Chronic use may lead to increased anxiety, with some individuals developing a persistent sense of worry and distrust. Frequent and intense mood swings, ranging from sadness to unexplained joy, can happen as well, impacting personal well-being and social interactions. Let's talk about the signs and symptoms of abuse upon assessment. There can be behavioral shifts. Individuals may start neglecting responsibilities and shift their social habits. often associating more with fellow users. Users might develop a strong desire to continue experiencing psilocybin's effects, often using it to cope or escape reality. With regular use, higher doses of psilocybin are often needed to achieve the same effects, leading to increased risks. A clear sign of this use is when someone continues using psilocybin despite experiencing damaging consequences in relationships, mental health, or career academic standing. Potential for overdose or use as a suicide weapon of choice. Overdose potential. Psilocybin mushrooms have low physical toxicity, making fatal overdoses unlikely. Yet, high doses can cause severe psychological effects like intense hallucinations and disorientation, as we discussed before, and this can lead to impaired judgment and potentially hazardous behavior. Risky behaviors. The altered state of mind can result in users not recognizing reality, increasing the chance of accidents. For example, users may misinterpret their abilities, like believing they can fly, leading to life-threatening situations. Suicidal ideation concerns. Psilocybin is not typically linked to suicide attempts, but its profound psychoactive effects can intensify suicidal thoughts in those who are at risk, especially. In the midst of distressing psychological experiences, delusional thinking may lead to self-endangering actions. There have been instances where people have jumped out of windows believing they could fly. Impact on mental health disorders. Individuals with mental health disorders such as major depression or psychosis are particularly susceptible. Their compromised ability to navigate the hallucinogenic experience may result in dire consequences. Okay, example of a care plan for a patient. Pharmaceutical approach. I'd start the patient on an SSRI or an SNRI to address their depressive and anxious symptoms. These meds help by balancing neurotransmitters like serotonin and norepinephrine. I also may suggest a anxiolytic in cases of heightened anxiety. I'd opt for Buspar. It's effective and doesn't carry the dependency risks we often see with benzos. Monitoring, I closely monitor the patient for both the effectiveness of any side effects of these medications and do regularly check-ins. Non-pharmacological interventions. I strongly recommend CBT for this patient. It's excellent for tackling negative thought patterns and developing healthier coping strategies. I'd also opt for mindfulness practices. Incorporating mindfulness stress reduction techniques would be another part of the plan. This can be really helpful in managing anxiety and improving emotional regulation. I'd also advise on making healthy lifestyle changes like regularly exercising, a balanced diet, and good sleeping habits. These are fundamental for mental health well-being. Patient education. I take the time to educate the patient about the nature and symptoms of depression and anxiety and how our treatment approach works. It's important to discuss the risks associated with psilocybin use, especially regarding its impact on mental health. I'd also emphasize the importance of sticking to their medication regimen and understanding how these medications work. For ongoing support, I'd refer the patient to regularly psychotherapy sessions. Given the psilocybin misuse, a referral to a substance abuse specialist or a relevant program would be in order. I'd schedule regular follow-ups to monitor how things are going, assess how well the medications are working, and adjust the plan as needed. Keeping an eye on the patient's overall mental health and their response to treatment, including any substance use behavior, is part of the ongoing process. Based on the patient's progress and feedback, I'd be ready to make changes to the treatment plan. All right, wrapping up our journey through psilocybin. Key takeaways, a look back and now. We've seen how psilocybin has evolved from its ritualistic roots and its current popularity, especially among young adults. Who's at risk? It's clear that individuals with mental health challenges are more vulnerable to the adverse effects of psilocybin misuse. Understanding the effects. We've delved into how psilocybin can alter perceptions in the short term and potentially impact mental health in the long term. Spotting misuse. Key signs to watch for include changes in behavior, a growing psychological reliance on the substance, and an increasing tolerance. Beyond overdose. While it's not typically toxic, the real danger lies in how psilocybin misuse can lead to risky behaviors and exacerbate existing mental health conditions. Comprehensive care. Treating psilocybin misuse isn't just about medications. It involves a mix of therapeutic approaches, lifestyle adjustments, and ongoing support. As we learn more about psilocybin and other illicit substances, it's important to remember that our job as psychiatric providers isn't just to treat, but to also educate and prevent. To provide comprehensive care, we need to make sure that our understanding of this substance is well balanced and appropriate.